name is Guerra, and I'm the co-founder and chief medical officer of iTriage. The allergies of symptoms are a runny nose, you can get a rash, and the rash is called hives. It's where you get the raised area becomes a little red and it's very itchy and it makes you scratch. You can have sneezing. There can be actually, if it's the histamine is one of the things that cause an allergic or cause the symptoms of allergic reaction. So you can actually get nausea, can have diarrhea. More severe symptoms would be swelling. So the swelling can happen in the lips. We call that angioedema. It can actually be of your tongue and the back of your throat. It can be quite serious. Yeah, you can also have the more serious, again, that's called anaphylaxis. A drop in your blood pressure because your blood vessels will dilate and your heartbeat can't beat fast enough to keep the dilated blood vessels filled with blood, and you can actually pass out and rarely even die. Allergies are caused by, think of it, first there's an allergen, that's something in the environment, whether it be mold or pollen or something you eat like peanuts or egg whites that people can be allergic to. And that causes a stimulus in your body. There's special antibodies called IgE antibodies that attach to the allergen and then cause a release of multiple different chemicals. One of them we mentioned earlier is histamine. But there's other chemicals as well, and those chemicals are what cause the symptoms of an allergic reaction. So it's people that are sensitive to those allergens. Not everybody is, just like not everybody is allergic to peanuts or pollen. Not everybody responds with that same immunoglobulin IgE response and the release of all those chemicals that cause the allergic reaction. Well, the treatments for allergies really depend on the symptoms. If you're having one of those really severe reactions that I described earlier, called anaphylaxis, then patients need epinephrine or adrenaline. And actually, patients that have bad reactions to those allergens should carry an EpiPen with them. Or if you're the parent of a child that has those bad reactions, you should carry an EpiPen for your child. And you actually self-inject yourself, because it's not something you take by mouth, you actually inject it. If the paramedics call, the 911 is called, the paramedics arrive, or you present to an emergency department with a severe allergic reaction, they'll give you the epinephrine in your skin, or even in an IV if it's really super serious. So that's on the life-threatening end. For less serious allergic reactions, over-the-counter diphenhydramine or Benadryl, which you can buy in any pharmacy, can be taken. There's other antihistamines as well that are either over-the-counter or prescribed that work real well. Some patients will be prescribed steroids, so a short course of a steroid which reduces some of the inflammation and some of the reaction can be used. And then other medications may or may not be used depending on the severity of the allergic reaction. Nasal sprays, antihistamine nasal sprays, antihistamine eye drops, if you're getting a lot of tearing and swelling of your eyes from your allergic reaction, can also be taken or prescribed. That's an interesting question. No one knows for sure. It's probably multifactorial. There's lots of great studies being done in why we're seeing more patients allergic to or having more allergies. One of the theories is we have super hygiene, or that they call the hygiene hypothesis, where we're using antimicrobial soaps and other antimicrobial chemicals to kill bacteria in our environment. And some investigators think that we're not being exposed to enough bacteria, that at least bacteria that don't cause serious harm. By killing all bacteria, then we're putting ourselves at risk to be having increasing allergies. So it remains to be seen if that theory will prove out. There's another theory that thinks global warming in and of itself is causing more ragweed and other pollens and other allergens in the environment, so causing more seasonal allergies. There's probably a component to our diet. The Western diet of eating more processed foods and how we introduce those foods into to children and to babies is another theory of why we're seeing more food allergies. And then the final portion is there's just more awareness among patients and providers. So more people are being tested, more people are asking for the testing, and that increases the number. But even in and of itself, that just increased testing and awareness isn't enough to explain the total rise of patients with allergies that we have experienced over the last 10 years. That's a great question, and a really important one. We've kind of alluded to what we call anaphylaxis. So what that is things that you should watch out for if you're suffering from a severe allergic reaction, or what we call anaphylaxis. Anytime the lips start to swell, the tongue starts to swell, it becomes difficult to swallow. You can also have severe wheezing, so it becomes very, very difficult to breathe. Anytime any of those are starting to occur, I need to immediately either call 911 or go right to the hospital, into the emergency department. Some other symptoms would be fainting. So we talked about that low blood pressure that people get from the dilation of their blood vessels. Sometimes their only symptom is really incredible lightheadedness. So you start feeling lightheaded, especially lightheaded with standing or even fainting, call 911. Because it's important to know that patients don't always get all the manifestations of a severe allergic reaction. You might only have the breathing component and no rash. You might only have the lip swelling or throat swelling component, or just the fainting component. So anytime there's breathing problems with lightheadedness or fainting, or you feel like your face is starting to swell, you need to get treatment immediately.